Right, so chapter 15 is on biofeedback, and specifically on electromyographic biofeedback, or EMG biofeedback. So this uses a particular device to give a person feedback to a physiological process, usually a muscle contraction, so that person can self-regulate that process. So really, we're going to just briefly touch on biofeedback. I only just want you to briefly be able to state some of the indications, contraindications, and precautions. There will be no more than one question on the exam on biofeedback. It will be easy. I promise you that. So, biofeedback as a whole is something that provides information about physiological or biomechanical processes that can be acted on to improve function and performance. So it requires action by the patient, by the user of the biofeedback. And unlike other physical agents, it doesn't transfer energy to the targeted area. All it's doing is giving that patient either a visual or an auditory or some sort of feedback that can allow them to change something to improve their performance. So biofeedback can either be direct or transformed. Direct is an accurate numerical value of bioprocesses. For example, a heart rate monitor. That's a great example of biofeedback. You can use that in the clinic. You can tell someone, I want you to keep your heart rate above 100 beats per minute. And they can use that heart rate monitor for direct biofeedback. They see that it drops down, they have to increase their energy output in order to keep their heart rate up. A transformed biofeedback application is something that creates a representative signal of muscular electrical activity. So the electromyographic biofeedback is an example of this. So there are lots of things that we do that really are, strictly speaking, biofeedback that are not the EMG biofeedback. So if you're doing anything that is helping a patient be aware of a physiological process so then they can voluntarily change that process to improve their performance, that is biofeedback. So the book is talking specifically about the EMG biofeedback. We're not going to do it in lab, and I'm just going to very briefly talk about it, indications, contraindications, and precautions. So the EMG biofeedback device, it's a portable device that allows for an audio or visual representation of usually a muscle contraction. So the little machine itself allows the therapist to determine, to set the device's sensitivity. So as someone gets better, it might need to be less sensitive. When they don't have muscle action, it has to be very sensitive. So it allows you to give that patient the feedback that they need to know that they're contracting the correct muscle, basically. So these are just some visuals from the book, examples of biofeedback devices. So in A, it's a little portable device about the size of a TENS unit, and what you do is you set the level of sensitivity, and you put the electrodes on the muscle, and it gives them visual and auditory feedback of when they are contracting that muscle correctly. So the picture B is showing the application on the patient. Picture C is of a device that's called a balance master or balance pad, and that gives someone visual or auditory feedback of basically midline orientation, different balance activities. We use this a lot in the clinic where I work with neurological patients, and it's really handy because a lot of times someone after a stroke or after some sort of neurological injury does not have a good midline awareness, does not have a good awareness of where their balance is, and this visual and auditory feedback allows them to tune into that and change their activities. So the physiological effects of biofeedback are it provides the feedback to the user for volitional alteration of activity based on myoelectrical activity or some other physical activity. And so its primary neurophysiological mechanisms are neuromuscular facilitation, inhibition, or coordination. And that is all we're going to say about that. There are a couple slides on those specifically, but you do not need to know that depth of information. So the indications for EMG biofeedback, the indications for any biofeedback are just about anything you can think of where some sort of feedback would provide better performance. But for EMG biofeedback, hemiplegia, whether it's from a stroke or from CP, quadriceps strengthening after knee surgery or knee injury is a really common use for EMG biofeedback. Headache, and in that case you're usually trying to do some muscle inhibition to relax muscle tension headaches. Pelvic floor disorders, including management of stress incontinence. And you use an intracavity device with that where it's actually inserted into the vagina or sometimes into the rectum to detect the pelvic floor muscle contractions. And it's a specific device. Chronic pain disorders and temporomandibular disorders. So the chronic pain and temporomandibular disorders are like the headache, frequently inhibition usage. So contraindications and precautions. You don't want to use EMG biofeedback with something where a muscle contraction is going to cause a problem. Acute fractures, severe muscle strains, or the third contraindication is if someone's allergic to the adhesives that you need to use to put the electrodes on. So those are the contraindications. For the intracavity sensors, they are contraindicated during pregnancy, bladder or vaginal infections, or within 6 weeks of pelvic or rectal surgery. Potential adverse effects are skin reactions to the electrodes, and if you're doing something that is causing a cardiovascular or strengthening exercise, you can have cardiac-related symptoms, dyspnea, fatigue, angina, or other cardiac-related symptoms. So and that is not really an effect of the biofeedback device itself, but of the cardiovascular and strengthening effects you are causing the patient to engage in when you're using it.